following on from our glucose reading, we may now need to administer the medication, insulin, to our client. This will be in the form of an injection. It's not a syringe or anything like that. It will be, as you can see on the table, a pen type device, and that's the only form of injection as a carer ideally would be using. Okay, so I'm just going to go through the equipment that I've got on the table here. So I've got 2 different types of pens. So the first pen that I'm going to show you here, when it arrives from the pharmacy, there'll be several of these in a box, and they'll be stored within the fridge. Okay. When I take that lid off, what you'll see is you can already see this one already has the medication within. Okay. So we're going to be looking at the name and the strength and actually the type of medication that this is, because we can have a quick release and a slow release. So it's about reading that information to understand what medication we're going to give at what time. So that's your first one. The second that I've got here, the pen itself doesn't have the medication within. Right. Okay. So it's about looking at how we're going to place the medication inside. So do you want to hold on to that one for me for a second? The medication will come as vials of insulin that looks similar to this. And again, they'll come in a box and they will be stored within the fridge. Now, ideally, I don't want to use medication that's come directly from the fridge. It's going to be really uncomfortable. So before I use this medication, I'm going to take it out from the fridge at least 1 hour. Try to bring it up to more room temperature so it's not as uncomfortable. But as with any medication, we're checking the name and the strength of the medication. And lastly, we are going to be using a needle. Okay. So with the needle, it does need to be sterile. So it's about looking at the expiry date, and the seal is completely stuck down and it's not broken or been opened. If it has, then we're just going to discard that straight away. Right, okay. So do you mind if I just take that pen? Yep. To get the medication within the pen, we've got a little black area here. It's where the medication's held. If I just give that a bit of a twist, I can remove it. And actually what I'm going to do is I'm going to place that over the medication itself, and I'm just going to gently pull it through so you can see, if I hold my hand up here, that white section has completely come through. Yep. And I'm going to pop my pen back together. You might be able to hear just a little click as I pop that in. You hear that? Yeah. So now that's in there securely. Okay. So with my needle, I'm just going to remove that paper seal. Yep. And I'm just going to gently screw that. I mean, it doesn't have to be tight. It's just finger tight. Okay. There we go. So it's finger tight. And I'm just going to take off. There's a clear cap that I'm just going to remove. We're going to keep that. We're going to come back to that one in a moment. Now, I don't know if you can see in here, this one is empty just for training purposes. But what you might see sometimes is the medication might look a bit cloudy, or you can see a separation of what looks like oil and water. So that just means that we need to mix the medication a little bit. Okay. So it might be that we tip it back and forth 10 times. And then once we've done that, we can then roll it back and forth 10 times. Sometimes they call it rock and roll. Yeah, I've heard of that. There we go. So before we administer the medication, what I will do is just check that the needle isn't damaged or blocked in any way. Now to do that, can you see this window here? Yeah. If I turn this little area here, you can see that the numbers are going up and down, so I'm changing the units. So whenever I'm putting a new tube of medication in, when I'm testing this, priming the needle, I think they call it. Yep. I'm going to turn it to 2 units. I'm going to keep it upright. I'm going to give it a little tap. Now the reason I'm tapping is because if there's any air bubbles, I want them up and out of the way. Okay. This small white section here, just gently and carefully remove that to expose your needle. And to administer that small dose, the black section here, if I just push it in, that will push the medication up and through the needle. In a real life scenario, this is where we would see a small droplet here. And this window on the side, as you can see, has now reset to 0. Okay. So once you've done that test and we've got that droplet, we're going to set a dose of 7 units. So again, this window here, going to set to 7. Now, I'm not going to administer this to Lenny. It's a little bit too much. So we're just going to use our little sponge here. And as you see, I'm going to go in at a nice 90-degree angle. Gently goes in and I administer that dose of medication. And we're going to keep it there for a count of 10. That just allows the medication to come through the needle and disperse. What I don't want to do is create a vacuum drawing that medication back out. So then after 10 seconds, we can then remove that needle. Now it's a very fine needle, so there shouldn't be a bleed. Maybe if somebody's on a blood thinner medication, it might be a small droplet. Just a bit of gauze or a bit of tissue on that will be absolutely fine.
Okay.
Now my main concern as a carer is I've now got a used needle, so I need to make sure that I'm being really careful and paying attention. So the outside clear cap that we kept, I'm just going to place it onto the table, and I'm going to slide the needle in. Once the needle's inside, I can then hold it, hold the pen so it doesn't fall apart, take that off, and I can then place that inside my sharp spoon for correct disposal. Okay. The medication itself is now going to stay in this pen until it's either fully used or a maximum of 28 days. Okay, so 28 days, if it's still in here, I can then take it out and discard it. Okay. So I can now pop the lid on. That will be stored in its little blue wallet. Doesn't need to go back in the fridge. Okay. If worst case scenario happened and we did catch ourselves with that needle and it broke the skin, we would recommend that you call Christie's office straight away. Give it a squeeze, run it under warm water. Don't be tempted to suck it. Give it a squeeze, warm water, make it bleed.
Encourage it to bleed.
Yeah. Call Christie's office, and then we will then advise you of the protocol for a needle stick injury.
Okay.